We're doing this to mark World Homelessness Day, which falls tomorrow. So because of that, it feels particularly special to have the opportunity today to tell you all about our work, and to talk to you, those of you who are watching today, because we wouldn't be able to do this fantastic work that you're about to hear about if we didn't have you guys on board supporting us in the way that you do. And I cannot emphasize that enough. So whether you put yourself through a tough physical challenge, or you donate to us regularly, you've planned to leave a gift in your will, fundraise through your workplace, or you give up your time to volunteer from us, thank you, thank you, thank you so much. And I know that I speak on behalf of all of my colleagues at Shelter when I say we are so incredibly grateful. And we wish we could be doing things like this in person. And I really, really miss meeting up with some of you who are on this call today, of course, due to the very strange times that we're living in. But oh my goodness, I have just been overwhelmed by the way so many of you have helped us despite these strange times, and the weird, wacky and wonderful ideas you've come up with to be able to support us while social distancing or isolating, and things like that. So I'm really delighted that we have some fantastic colleagues of mine to tell you about the work that they do, and we can crack on with that now, because I'm sure you haven't come here to hear from me, you've come to hear about the amazing work they're doing. So we have Polly Neate, Shelter CEO. We've got Ellen and Heidi, who work in our Transforming Rehabilitation project in Manchester, and Andrew, who is a Time for Change peer mentor in our Edinburgh hub. So first of all, I would like to welcome Polly, who is joining us today.
Hiya. Hello,
Hi,
everyone.
Polly. Hiya.
Hi.
How are you?
Yeah, I'm very good, thank you.
Good, good. Well, welcome, and thank you so much for joining us. I know that the fight against homelessness and bad housing never stops, so we're very grateful to have your time this morning. Obviously, it's been a really strange year, and I'm sure, like me, you've been overwhelmed by the amazing support that we've had.
Yeah, absolutely. And we've really needed it more than ever this year as well. So I always feel, of course, grateful to our supporters, but I guess I do even more at the moment.
Yeah, absolutely. I feel exactly the same. I mean, there's obviously been a lot of challenges this year in particular, but what would you say, I guess, are the greatest challenges that we at Shelter are facing at the moment in that fight?
I mean, I guess so. It has been a very challenging year. I guess the biggest challenge is just the economic crisis that we're all in. So the pandemic affected a lot of the people we help really badly. And particularly, I was absolutely found it really upsetting, actually, hearing about, particularly, I guess, families in situations like hostels and bed and breakfast. So where you've got maybe like a mum and 2 or 3 kids in one room in a bed and breakfast hotel, and then there's a corridor, and all along that corridor are other families in their one room. You don't know them when you first move in there, and then at one end you've got a communal kitchen, and at the other end you've got a communal bathroom, and you're expected to observe social distancing and keep your children safe during the pandemic. And frankly, it's not possible. So I guess what we've seen is an existing housing crisis colliding with the worst public health crisis in living memory. And the people in the fallout of that are the people that we support at Shelter. So I think that's been the biggest challenge, is we've seen a big increase in need and a dropping off in our ability to meet that need, because we have suffered quite a significant hit to our income this year, in common with many charities. And I guess the pandemic was a huge challenge in itself, but the economic crisis that is following the pandemic is almost worse, really. And we are definitely going to see an increase in homelessness and an increase in need. And again, that's on the context of our, as I say, a housing crisis that already wasn't being managed and wasn't really being dealt with. So I don't want to sound, I mean, that sounds a bit negative. I can talk about the brilliant things that we've done to try and meet that challenge, but that is definitely the biggest challenge, and it's by no means over yet, you know. And so the government's emergency measures are coming to an end, which I fully understand. You know, I don't expect the government to keep furlough going forever, for example, but that is going to lead to people losing their jobs, and that in turn is going to lead to, for some of those people, homelessness.
Yeah, and I think, like you say, you know, we can see that this is about to happen. And I think what I sort of found really difficult to think of during, you know, especially when we were in lockdown and we were told to be in our homes, was that, like you were saying, there were some people in just horrific
Yeah,
accommodation.
and it horrified me actually, because there was, you know, the very people that we were all standing outside our houses clapping on Thursday evenings during lockdown, people like, you know, not so much doctors and nurses, well, actually some nurses, but people like hospital porters, care home workers, who are really low paid, delivery drivers who are on 0 hours contracts or totally casual work, people working in supermarkets, for example. All of those people are the people who have been really badly impacted by the housing crisis, and by the fact that the housing crisis has been made worse by the pandemic.
Yeah, yeah, and it's sort of, yeah, just sort of step back and really think about that. It just, you know, the people who sort of kept us going throughout this difficult time are the people who are probably struggling the most, some of them. So yeah, I think
That's
it's,
right.
yeah, definitely a big job on our hands with that. But I mean, we have had some incredible successes
Yeah.
recently, and in the time that you've been here. You know, I know there's lots of things that you're really proud of. So do you want to tell us about one or two of those?
Well, I guess, I mean, just sort of carrying on with the theme of COVID, which I'm sure everyone doesn't want to talk about, but so one of the things I'm actually most proud of during my time at shelter is the way that we've risen to the challenge, and just two things. So I think one of the special things about shelter as a charity is that we are here to change things. We're not just here to like moan about how bad things are. We want to change things, and we are about change, and we work for change with individuals in communities, and then through our campaigning across society. But we base the change we work for in our campaigning on the experiences of those individuals that we work with. And one of the things that I'm really proud of is that when lockdown first happened, immediately we realised, because we are in touch on the ground with the individuals most affected, we realised that if people were going to be evicted during lockdown, they were not going to be able to find somewhere else to live. And so we pushed the government really hard and campaigned really hard to get the government to put the evictions ban in place. And they did. And in fact, they then extended it twice. And that applied in both England and Scotland. I'm really proud of that, because, you know, yes, it was an emergency measure. Yes, it hasn't solved the housing crisis, but it did mean during lockdown, we definitely saw much fewer people being made homeless than we otherwise would have seen. So I was really proud of that. And also I was really proud of the way that we are, a lot of our support workers and advice workers, immediately in lockdown completely changed their work. So where they couldn't see people face to face anymore, they all just moved onto our helpline and our web chat, and started to support people that way. So we were able to then really increase the capacity of our emergency helpline so that we could help more people. So I was really proud of that flexibility as well, the way that our people just completely changed the way they were working overnight, in order to be able to continue to help people in lockdown and to help more people as well. And that I'm really proud of as well. So there are loads of things I'm proud of working for shelter. I mean, it's an incredible privilege to do my job. But I think those two things sort of show why it's such a privilege, because just the people that I work with, colleagues, are just incredible. I mean, they really are incredible.
Yeah, and I think, everyone who works at shelter is so proud of our staff who've been working in the hubs and on the helpline during this time. I've seen just in my area in London how the staff from the London hub just completely, sort of learn new skills, I guess, and just
Yeah.
change the way they worked completely, and did
And
it
the other
absolutely
thing,
seamlessly.
yeah, totally seamlessly. And the other thing we did was, where we have a presence in local areas, in some areas, community groups got together and organised really, really well from the beginning of the pandemic, but in others, not so much. And quite a lot of our hubs, the managers in our hubs have I'm sorry, I've just seen the thing about a ukulele Zoom session.
I've just seen that.
It's just flashed up on my screen and it's really distracted me, but it just sounds like really cool. I'm going to go and join that now. What I was going to say is, so where our hubs really felt like there was a bit of a gap there, or a bit of a vacuum, they've reached out to partners, much smaller sort of local organisations, and helped to coordinate the local effort. So that's been really good as well. Sorry, I'll shut up now.
No, it's absolutely fantastic, and I think we're all incredibly proud, and we are in a little while going to hear from a couple of the projects that two of our hubs work on, about sort of the work that they do, and they've been impacted by the COVID crisis as well. So we'll get to hear a little bit more about exactly how they've adapted a bit later on. But I mean, there's been so many successes and still so much to do. So what do you envisage us achieving in the future at Shelter and moving forward?
Well, one of the main things that we are going to be doing moving forward is really developing and building on that work that we do in our local communities. So, for example, we're employing community organisers in our hubs, which is a really critical role to help us to reach out into local communities. And I talked before about being about changing things. So I think at the local level, we need to be, as well as, advocating and fighting on behalf of individuals and providing support and help to individuals who are either homeless or facing the prospect of homelessness. We also need to be looking locally at what are the systemic reasons in this locality that are leading so many people to be in that situation, because unless we can start to tackle problems a bit more upstream and look at prevention a bit more, we're still going to be seeing this sort of overwhelming need coming through, and we're not going to be really changing that. So we are focusing on, we're calling it bases for change. So we're focusing on our hubs, as well as being places that people can come to for support, also being bases for change in local communities, where we're working in partnership to really try to address the issues that are causing homelessness and other housing problems in the first place. So that's one thing that I'm really excited about. And that work has started, and in fact, it started before the pandemic, but I think it has been given an extra momentum in a way by what we've experienced in our communities during the pandemic. And I guess the other thing for me is that if you really look at why we have such a bad crisis in this country in terms of homelessness, the risk of homelessness, unaffordable housing, the root of that problem is that for generations, we've given up on the whole idea of social housing or council housing. It's like the forgotten arm of the welfare state. And we're really gearing up to do campaigning over that. And I want people in the UK to feel as shocked by our housing system as they are by the healthcare system in America. Because there are, if one of us, God forbid, is in an accident in this country, we expect to be picked up by an ambulance. We're taken to a world-class hospital and we get world-class medical treatment, whether we can afford it or not. In housing, that is not the case. If you become homeless in this country, you are in for a serious, really neglect from the state. And we really do need to change that. And the way we need to change it is to get the government to invest in building social housing. So on a campaigning level, we're already campaigning on this, but over the next months and couple of years, we are massively gearing up to make that change in the country so that we actually live in a society that protects people from homelessness, as well as doing what we do to help people if they do end up homeless. You know, we also need to be doing our campaigning to stop that from happening. So I guess that would be sort of two things for the future that I'm really looking forward to, really excited about, and excited to kind of get to grips with those challenges.
Yeah, no, we've got some amazing campaigning stuff come out. So everybody do look out for that. There'll be ways that you can all get involved, whether it's signing a petition or sending on an email, you know, or just talking to people about what's going on. Because I think that's part of the problem, is that people who are comfortable don't really realise that what is going on in other people's lives.
I think that's right.
Yeah, which can be really, you know, really awful things going on. And for anybody who does want to know a little bit about community organising, we did actually do a bit of a Q&A with Tyrone, who is one of our community organisers. He's based in London, and that is on our YouTube channel. So do speak to whoever your contact is, whoever invited you, and they'll be able to send you a link to that if they speak to me. So yeah, because it's really great to hear from Ty and all the work that he does. And I know that sort of grassroots work that they're doing across the country is yeah, really, really important. So thank you, Polly, for joining us this morning.
That's all right.
And chatting to us about what's going on. And
you're really welcome.
There's so much exciting stuff happening. You know, I think there's a lot of stuff that really sort of gets people going here at Shelter. I think there's a lot of passion behind everything we do from everyone that works here. And because of that, you know, we are going to make a change. And I know you're very determined that we will do. So thank you.
That's all right. You're really welcome. And thanks again to all our supporters. You know, we've said it, but I do want to say it again. We couldn't do any of what we do without your support. As a charity, we are dependent on donations. And so we are very, very, you know, we really are very grateful. Bye-bye.
Thank you, Polly. Have a great day. See you later. Bye. Well, that was fantastic, wasn't it, to hear about, you know, what Polly's vision is for where we're going as a charity and how we're going to continue to help people, both those on the ground and also the campaigning we're going to do to make sure that people don't end up in the situations that they're currently in. So that's, you know, absolutely fantastic to hear. We are going to speak to Heid and Ellen in a second about our Transforming Rehabilitation project in Manchester. But just to say, they are able to hang around at the end a bit for any questions. So if you have any questions for them or Andrew, who I'm speaking to afterwards, there is a chat box at the bottom of your screen where it says chat. If you click on that, it'll open a chat box and you can type any questions you might have in there, and my colleague Roz will put those to the guys who we're about to speak to at the end. So do make sure you do that, and leave any comments you want. It's always great to hear what you think about our services as well and the work that we're doing. So welcome to Ellen and Heidi.
Hi Daisy, how are you?
Hello, good, thank you. Hi Heidi, hi Ellen. So thank you for joining us this morning. Again, there's a lot of work going on in the project that you're working on up in Manchester. And it's great that you're here today to tell us about it, because I think it's probably an area of our work that people don't really automatically think about, and that is our Transforming Rehabilitation project. So can you tell us a little bit about that, what it is, what it involves?
Yeah, sure. Good morning, everybody. Firstly, thank you for having us and listening to our work, really. We're really passionate about it, and it's something that goes unnoticed and unhidden. It's hidden quite a lot. So fundamentally, we're based in prisons throughout the country. So for our project, we've been delivering this service since 2015 now, this one in particular, and we cover 13 prisons within our regions. That includes women's prisons, open prisons, category B prisons, all of them really. So fundamentally what we do is we work with prisoners coming into custody and those getting released from custody as well. And we cover three main sort of objectives really around accommodation, employment, training, and debt and finance. So I'll just give you a little bit of a rundown about sort of the activities we do when they first come in. So when a person first comes into custody, we focus around their initial needs, their goals, their aspirations, but also critical work that needs to be done. So around accommodation, it might be a case of somebody who has a tenancy already that needs to keep that, or it needs sustaining depending on the length of the sentence. We liaise with housing providers, local authorities, private landlords, anybody that tenancy or mortgage is with really. We also focus on employment and training. So we work with training providers, colleges, universities, employment to either retain that job or training course, or again, try and freeze that for when they get out basically. With debt and finance, again, this is quite a big one. We support with advice and advocacy around rent arrears, debts, loan sharks, day-to-day stuff you wouldn't necessarily consider, so mobile phones, freezing water, council tax, little bits like that. So if you first came into custody, it's like, what on earth, what do you do? So we're that team. We're very passionate, we're very driven to support that individual with what they need at that time. Being released, so ideally we pick that assessment back up 12 weeks prior to release and see what's outstanding and what needs to be done. And this is where we focus on them needs that need completing, but also anything new that might have transpired during the sentence. So you could have had somebody that's in and out of custody within 2 weeks or 12 weeks, or somebody who's been in several years. So again, the needs are very different. We have quite a lot of complex housing issues, those that have either got restrictions, exclusion zones, those that might need further advocacy or intense work. So again, we support with those individuals around complex homelessness or just little interventions that are needed as well. We run groups, so quite a lot of group work around tenancy support, loan sharks. Again, anything they need help with, we support around that. And we work very, very closely with probation officers, offender management units, other colleagues, mental health workers, to try and tie that approach together to support of tailor that needs for the service user. And we also have peer mentors within the prison that work with us to support, get maximum engagement levels as well. That's basically a nutshell of what we do.
Brilliant. Yeah, so it's real like wraparound care, isn't it? It's not just as simple as going in and be like, right, let's see what your housing situation's like. You actually, really make sure that they're in a good position for when they get out to, not only be housed, but also in other areas of their life. So that's, it's absolutely amazing project. And I don't know whether this is for you or Ellen, but what would you say, I guess, are the main challenges of working in a prison? It's there must be some challenges, I'm assuming.
Yeah, it is a difficult environment. I think when everyone thinks of prison, you think of of that a big establishment, and it's a difficult place to work. It's a difficult environment to work in. I think there are multiple kind of challenges to working in that prison, and some of them are specific to each prison. And like Heidi said, we work across so many prisons and different category prisons, and they might have female residents or male residents in there, and that that really alters kind of the challenges that we have. So in general, I would say that one of the biggest challenges we have really is the prison regime. Obviously the prison has a lot of functions and services in there, and we have to fit around the running of the prison. So it can be simple things like access to service users. We have to fit around what how the prison works. So we can book in to go to see an individual. We might have everything planned and organised, and an alarm bell rings. There's an incident. The wing has to be locked down and quick. That appointment's ended, and we have to really be adaptive. The staff have to really kind of expect that and try and manage the unexpected, which is a challenge in itself. I think some of the other things that are really difficult are around, Heidi mentioned short sentences. Particularly, I managed the service in female prison near Manchester Airport, HMP style. And one of the biggest problems that we have is around 65-70% of the women that are in HMP style are in custody for less than 6 weeks. So there is a real quick turnaround and a short period of time in which we get to engage with that individual, build that rapport, and kind of offer the support and the guidance and achieve those outcomes. You know, it can be as short as 7 days. And when we're talking about bank holidays or over Christmas is a nightmare. With all the bank holidays, you know, people get released early. And so we might have 4 days to work with somebody to secure accommodation, which, as you can imagine, yeah, is a real challenge.
Yeah,
so,
I can imagine that's really tricky, having sort of such a quick turnaround. Like,
yeah.
you know, you have to do basically everything you do in a longer period of time, but in such a
very
short period. Yeah.
Yeah.
I can't imagine. Yeah.
Yeah, you know, the staff are amazing. They're great. They really react to things and are, you know, like I say, they're just so adaptive and just are wonderful at dealing with those situations. But it is very stressful. And obviously we want to achieve those outcomes for service users, do you know? So yeah, it is. It's definitely a challenge. I think one of the other things is that whilst we're used to working to those timescales and those short turnaround, a lot of services aren't. Do you know, that's quite a prison specific thing, do you know? And so when we're liaising with external agencies, they might not be working as quickly as we do. So we, again, you know, as Heidi said, we've worked in this area for a long time. We've had to build those relationships up and develop those kind of links and engage services so that we can work on the same time scales. I think one of the other things, a really big challenge, is just accessing services. So staff don't have mobile phones, our service users don't have access to phones, our services users don't have access to the internet. You know, you would be surprised at the amount of times I've rung banks, housing providers, you name it, and said, I'm ringing on behalf of named service user, providing, you know, a consent form. Can you just get them to log into their internet banking? You know, can you just tell them to do X, Y, Z? Yeah, I actually can't, sorry.
Just not possible at all.
It's
No,
not.
yeah.
No, so we have to be really inventive on the way we kind of respond to these. But, you know, it's an exciting environment. No 2 days are the same. But yeah, challenging.
Yeah, I can imagine. I can imagine it. Yeah, it sounds like you're sort of up against some really difficult barriers, but you still managed to do fantastic work. I mean, and this year I imagine has been particularly tricky. You know, I think everyone's had to adapt the way they're working. But how have you guys had to adapt the way you're working, you know, since sort of COVID kicked off?
Yeah, so obviously we're very innovative, very creative and very passionate about delivering these outcomes. So the staff, frontline staff, have been working throughout in the prisons and throughout the whole of COVID, which is fantastic. As you know, obviously the government have had these phases, and as have we, and we've had to adapt within them parameters of what we can and can't deliver. So as Ellen said, it's very difficult anyway working within a prison regime. It's even more difficult when you can't access the prisoners within a prison regime. So there's less technology that we can utilise. There's less resources we can utilise. So we've had to really focus on what's available to us. And again, working closely with our colleagues. So a number of things we've done is try and utilise self-assessment forms. So whereas we used to see clients face-to-face, have a really good interview with themselves, we now use self-assessment forms. Some prisons are fantastic. They've got in-cell telephones, so we can ring from our office to their telephones, get more information, maximise the engagement levels as well. We've utilised peer mentors that are currently working in the prisons with us. So they will get a list of service users to sort of get their engagement as well. We are moving down the phases now, so we're starting to do face-to-face interviews with the most vulnerable within the prison. So again, it's about what prison are we in, what staff team are there, what resources are there, and just trying to be inventive. On the flip side of that, we work very closely with local authorities and housing providers. And historically, what used to happen is we would facilitate a telephone call with a housing provider and an interview would occur. Again, sometimes that can't happen now. So what we're doing is, how can we get you the best information that you need? How can we facilitate that? And how can we speed up the process? What we don't like to see is service users being released homeless and service users being released with a myriad of appointments for the day. It's very confusing. It's overwhelming when they get out. So what we try and do is mitigate against that and put as much in place as possible to be able to support them and again, do that wraparound care. So we've said to the local authorities, what can we do to support you? What do you need from us? Let's maximise this process. So we'll put different processes in place. We've got different communication styles and levels now that we can utilise. And again, with the prisoners, what do you need from us and how can we best serve you while we're here? So that's some of the options we've used.
Yeah, it sounds like you really had to sort of think about how you can still get to these people, and like you say, the ultimate aim is to make sure they're not released with nowhere to go.
Yeah.
I can imagine how confusing that must be to be released and, like you say, go to loads of appointments in one day about various different things. It's probably a bit overwhelming being out anyway. So it's amazing the way you guys have adapted. So yeah, thank you for that. And I'm sure everybody watching today is thinking how fantastic it is that you've just sort of seamlessly moved on to this virtual way of doing things. Seemingly seamlessly. I know a lot of hard work goes on in the background. So that's absolutely amazing. And I'm just wondering if you two can give maybe one or two examples of people who've been helped through this project.
Yeah, I can give some examples of service users that we've supported. I think a really good example is we were working with a female service user who was homeless in one of the Greater Manchester local authorities. She had a history of coming in and out of custody on very short sentences. She had multiple support needs, mental health, substance misuse, and she required some quite intensive supported housing. That was secured for her, and unfortunately she didn't attend that accommodation when she was released from custody, and subsequently she was recalled and she became one of our service users again. One of the team in there built a really amazing relationship with that service user and actually kind of found out a bit more about why did you not attend. And actually what had transpired is that service user's son had moved while she was in custody the previous time. She wasn't aware, and actually the accommodation that had been secured for her, it was 2 or 3 bus journeys away from seeing her son, and that was just so overwhelming for her that she just couldn't engage with that process. So my member of staff worked really hard and actually found a tenancy that also had a support element to it that provided that intensive support, worked closely with the mental health services, with the substance misuse services to make sure that they were all in place for the area that she wanted to be in, near to son's new address. And actually my worker secured over £3,000 to pay towards that tenancy, which is just fantastic. She was able to move in the day she was released. It was near her son. She got that support. Those sorts of kind of tailored responses and case studies were amazing. And actually, since then, she stayed out of custody. We haven't seen her again. That's wonderful. That's amazing. I think. So another example that we've got is we worked closely with the service user who was in custody and had been in custody for quite a long period of time. Again, complex, working with the mental health service, substance misuse. He was engaged with the learning disability nurse in the prison. It was quite clear from this package of support in the prison that this individual, had multiple complex needs, and that this person obviously needed accommodation and would be priority need under housing law. Unfortunately, lots of the mental health issues and learning disabilities were undiagnosed, and the prison weren't able to diagnose. They knew that this person needed the support and were providing that support, but it's really frustrating they couldn't put a label on it. And that was so difficult for us. It's a catch-22 situation. When we're making applications for accommodation on behalf of somebody, whether that's to local authorities or specialist supported accommodation providers, those labels can be quite important, and unfortunately, local authorities saying, no, he doesn't tick that box. And that is so frustrating. So we have to work really, really closely with those providers. And in that situation, what we managed to do was we did a referral to our adult social care. The local social worker that was allocated to the prison attended, completed an assessment, and they set out a set of recommendations, which included exploring diagnoses on release. We successfully managed to use that assessment to argue with the local authority that actually this was sufficient information, and that they agreed with us eventually after a lot of hard work. And it was great because they accommodated him in specialist accommodation that would provide that support. And by having that address for release, he was able then to engage with all those services. It's ridiculous, the frustrating process, because without that release address, the mental health services can't refer to community mental health. We can't get an allocated, learning disability nurse. It's just so catch-22 the situation. But yeah, just those working really hard, and like you say, working kind of across the boundaries. It's not just housing. You've got to work with all those other areas, and that really makes it a success story.
Yeah. Oh, that's amazing to hear about both of those. It sounds like you come up against so many brick walls, before you actually manage to make a bit of a breakthrough. And it must be frustrating, but so rewarding at the end when you see those people getting the help they need and having somewhere to live when they come out. And it sounds like with the first one, it sounds like probably a quite important part of your team is, I guess, building trust. And and finding out sort of a bit more about what the problems are and stuff.
Yeah, hugely. And I think one of the things that we say is that our service users are assessed by so many people. When you're in custody, you are assessed by the prison, you are assessed by mental health, you're assessed by all of these other services all the time. And then, it must be so overwhelming, but B, tedious for service users to have to really explain things over and over again. And I think us working with those other services and saying, okay, so what do you already know? Let's work collaboratively rather than independently. That makes a huge difference for our outcomes and for the service users. It's wonderful.
Yeah, well, keep up what you're doing. It's absolutely amazing, and it's a project that everyone at Shelter is really proud of. So it's fantastic. And guys, do remember, if you're watching, to pop any questions you may have for Heid and Ellen in the chat box, and we will ask them those at the end. So you have an opportunity to speak to them in a little bit. Thank you both so much, and we will speak to you in a little while. That's no worries. It's my pleasure. Brilliant. I mean, that's just fantastic, isn't it? It's such an important service that we have, and like I said, one that we're really proud of. It's ensuring people don't get out of prison and have nowhere to go, and it's like, it sounds like from what they're both saying, not having a home then leads to lots of reoffending and back in the prison service. So yeah, it's brilliant. Those examples we heard are fantastic. Now it's time to introduce Andrew. It's a pleasure to introduce Andrew, who is one of our peer mentors in Edinburgh, and he works on our Time for Change project. Hi Andrew, how are you?
Yeah, I'm good. Am I coming through okay? I'm sorry, I'm using a tablet.
Yeah, no, that's fine. Yeah, I can hear you all right. We're so used to all these technical problems now. I think everyone's been working from home for the past 6 months or so. It's just there's always something, isn't there? Always something. But yeah, thank you for joining us. So you work in the Edinburgh hub in the Time for Change project. And can you tell us a little bit about your situation before you got involved with Shelter, and I guess what led you to get involved with us?
Yeah, so I was homeless myself a few years back, just after a marital breakdown, and I had to go into a private accommodation that I couldn't afford. I knew I couldn't afford it when I went in, but it was the only option I had. When that accommodation was withdrawn, I then had to go into presenting to the council as being homeless. Obviously, I knew at the time who Shelter was, but I didn't know what they did. So I just went down on my own. I was fairly confident at the time, but I got told that I made myself voluntarily homeless. I was working a 0-hour contract, so I couldn't guarantee what shifts I was getting. I couldn't guarantee if I could pay the rent. And I got put into the first temporary accommodation, which was the start of a journey. I mean, homelessness is a journey. It was massively the start of a journey for me that was really traumatic. I didn't realise at the time. It's not until you're outside the bubble that you realise just how bad things can get. But I was studying at Edinburgh University at the time. I was working a 0-hour contract in a pub, and I had to go through all sorts of nonsense within the temporary accommodation. There was curfews that were really demoralising, dehumanising. And basically, I wasn't allowed to leave before 6. I wasn't allowed to leave before 8 in the morning. Sorry, I wasn't allowed to come back after 10 p.m. at night. So I could only take the day shifts at the pub while trying to study full time. And when I was out studying, my my room got broken into. Luckily, my fashion sense is terrible, so nothing got stolen. But yeah, I mean, I went from there. I had to drop out of university. just because of the situation, and I found myself a second job again on a 0 hour basis. And the curfews and the treatment that you get in temporary accommodation is absolutely shocking. It's really terrible. I actually got kicked out of the first temp that I was in because the curfew was 10 p.m. One of the jobs I was doing was I was working in Dundee, and for for anyone that's geographically indisposed as I am, yeah, we broke down just about the Forth Road Bridge, and I arrived back at temporary accommodation 45 minutes late to find that my bags were packed, 2 bin bags with everything I owned, and I had to go and basically sleep in a park that was quite local. I then had to present at the council again, where again they told me I'd made myself homeless, even though I was working 2 jobs. And it was terrible. 0 hour contracts and the mental health issues that come along with things is shocking. But they put me into a second temporary accommodation. You know, the staff were quite abusive, which was a really hard thing to go through. But again, when you're inside that bubble, you don't really realise just how much you're being treated in a very dysfunctional and destructive manner until you come out of it. And I ended up in 4 different temporary accommodations because of curfew issues when it came to working. It wasn't because I was out. I never had any substance issues. I never had any issues with alcohol. This was purely because I was trying to work. That got me out of these. And the only way that I got out of temporary accommodation was to move into an unlicensed HMO flat. So these flats should not exist, but it was a flat share that allowed me to get out of the situation, so I could gradually work my way back up to being the person that I was before. I've been a union rep in 2 different jobs, never had issues with work, but it was only really the rise, and this is one of the things that I wanted to talk about. It was only the rise in 0 hour contracts and very short-term precarious work that's sort of caused this, and obviously the marital breakdown. Edinburgh's, as you guys will know in London, Edinburgh and London are very, very expensive places to stay. I could use a few tropical words, but I won't. But yeah, I mean these things were all. It was a cumulative effect. It all sort of added on to each other. And it was only by going into an unlicensed HMO that got me away from, although still technically homeless, I wasn't allowed to register as staying there because I would be breaking the law. I didn't have any access to services, even things as simple that people don't really think about, things as simple as access to a doctor. I had to still tell them that I was homeless and then go to whatever GP they sent me to in Edinburgh, which could mean a 12-mile journey. When you were in there as well, really simple things that people don't think about, and this is part of what homelessness is. Simple things that people don't think about that you take for granted. Doing your washing. If you take a black bag of dry, dirty washing to your local laundrette and wash it, but you don't have enough money to pay for the dryer, you're pulling back something that weighs twice as much, and you're having to hang over doors, chairs, the end of your bed, just whatever you've got in the room. These really simple little things are absolutely brutal. But on the back of that, I mean, eventually, after being in the unlicensed HMO, the only reason I got housed properly wasn't through a local authority, it wasn't through any help that I got from anyone. It was because I took out a massive loan that I couldn't afford to repay. But I took out a massive loan so that I could pay a deposit for a private let, which is where I am now. It's been managed okay, but a big part of what we need to do with shelter and part of what Time for Change is we need to make people more aware of who shelter are, what they do, the success stories that we've had. I only came on board as well, guys. I only came on board during the COVID lockdown when it was really bad back in May. So the things that shelter have done and the things that we've been able to do through shelter have been massively, massively important, and something that's really, really important to me. And we couldn't do it without you guys supporting us, and we really couldn't. You guys are absolute rock stars. because we couldn't do that without you guys, is a massive awareness campaign. There are so many different things that we're doing just now. But yeah, sorry, that was sort of my story from where I came from.
Oh, no, thank you for sharing that, Andrew, because I know, like you said, it's sort of like I know when I was speaking to you the other day, you said it's not sort of, you haven't, the weight of it all didn't really hit you until you were out of that situation, which I can imagine, and to me, and I'm sure to everyone listening, it just seems mad that, those curfews, you're trying to work, so you've got enough money to get out of that situation, but the curfews aren't allowing you to do that. And like you say, it's really demoralizing, and it must have been so tough. And you're a hard-working person who wanted to work, who wanted to study, and the fact that you then had to give up your studying to, because your situation was just so awful that wasn't feasible anymore. It's just crazy that people who are trying to improve their lives and move on are being held back because of housing issues. It's just absolutely awful. So we're so pleased that you're in a better place now and that you're with us. You're helping and working in the Time for Change project. So can you tell us a little bit about the Time for Change project, and how did you come to get involved in that? I know it covers a lot, doesn't it? So it's quite a tricky question to answer that one.
It is. I thought very long and hard about this, how to define what Time for Change is and what we do. And I could ramble on for about 40 minutes just telling you all the different things. But quite simply, what Time for Change is Polly and the guys in Manchester, Ellen and Heidi. Thank you guys for telling us what you're doing, because we're going to definitely steal a lot of your ideas. But yeah, Time for Change, basically, we do the things that other people spend a lot of time talking about. And we just really get in and get stuck in. So again, like I mentioned, I joined Shelter via Anthea in Scotland, and she put me on to William Wright, who is an absolute legend. If you guys haven't spoke to him, he's doing so much work. But yeah, what Time for Change does is basically we're trying to do so many different things at the same time. So a lot of it's about raising awareness. I'm dipping into different teams, so I think I've probably stepped on a few toes and annoyed a few people. But that's, if it gets things done, it gets things done. But yeah, a lot of what we're doing is we're helping people who present as homeless. We're going to local council offices and actually assisting them, because one of the big issues that we find is when someone presents at an office to say that they're homeless, they get assessed. So they get put in a tiny little room, and it's about a 15-minute interview, and then they get left on their own in that little room for about 15 minutes, and then quite often the council will come back and say you've made yourself homeless, so they can only house you for 60 days. So we're assisting people with that and pushing back on what their rights are, because as Ellen and Heidi mentioned, when you've got multiple complex issues, when you've got people who've got maybe undiagnosed mental health issues, complex needs, that's not taken into consideration until it's assessed. But if you're too shy or not confident enough to mention that during that interview, that massively affects your homelessness application. We're doing street walks, so we're going out into the community. And again, I think Ellen and Heidi mentioned that as well when it comes to what they were doing. Going out on street walks and just really talking to people who are street begging. And there's a lot of people who street beg who've got houses, but they're at risk of becoming homeless. And to give you a quick example, I was out on Friday last week, and I spoke to a few different people. But 3 of the people that I spoke to had their own houses, and the reason they were street begging was because of universal credit. That's a huge thing. Being sanctioned or not having received your first payment, lack of help from government. There was one girl who was 6 months pregnant, or 5 months pregnant, sorry, and she was street begging. She only gets her other kids at the weekend, and she was street begging purely because she had no electricity in her meter, and she wanted the kids to be able to have electricity when she got them on Saturday. And this isn't really when people think about what Shelter does. But she said that she'd spoke to her service provider, and electricity company, and they said there was nothing they could do. So she was out there with a cup trying to get enough money to put £15 on her meter. And I phoned the provider directly, and I had to pass the phone over so she could go through the security questions. And then when I took the phone back, I maybe rightly or wrongly, I went through them. I shouted at them and I says, "You need to get this sorted now." I says, "You've got a pregnant woman sitting on the street begging for change so that she can put some electric in her meter." And they said there was nothing they could do. There was some pushback there, but because I argued the case where maybe she didn't have that confidence to do so, we managed to get her £20 put on her meter through an emergency one-time code. And then she felt so guilty. She felt so guilty. She wanted to hand back. She had about £8 in her cup, and she wanted to give the money back to the people that had given her the money. Some of these stories are absolutely heartbreaking, but this is the good work that we do by being able to do the street walks and by able to go out and walk about and just speak to people. It's that presence in the community which is massively important. We're also looking at teaming up with a charity in Edinburgh called Street Work. They will literally go about, and that's what they do. They go about and talk to people who are rough sleeping. So we're hoping to be able to partner up with them. The work's in progress at the moment, and again, William's been fantastic in helping with that. The other guys, the other peer mentors in Edinburgh, Michael and Lindsay, they're already doing things like presenting with people at council offices. This is the work that we do because you guys support us. We can't do this without you guys. There's a lot of work going on with prisons as well, so I would be interested to tie in with Ellen and Heid at some point, so I'll send you guys an email, because we've got, in principle, an agreement with Stockton Prison in Edinburgh to help people when it comes to release, because when you come out of a prison, in a lot of circumstances, you get your carrier bag and you stand in the car park not knowing where to go, who to talk to, what to do. So we are going to be doing a lot of work with that as well. Simple things like were mentioned before, getting mobile phones to people. I need to drop off a mobile phone on, I think hopefully on Monday, to a Spanish national family who don't have access to that to help with their housing. And the other big thing I'm doing, I'm managed to get back into studying, so I'm now studying social services. So another big thing that I'm doing just now is I'm, like I said, stepping on toes is what we do. I'm stepping on the toes of the Student Association, and we're planning a virtual takeover of their online hub. I was hoping it would be sorted by now with World Homelessness Day being tomorrow, but we're planning a virtual takeover for shelter. So it's going to include petitions, things like the Big Walk, all the different things that you guys already support us with. So yeah, sounds so wrong, but yeah, we're pretty much, we're going to bully the Students Association into giving us our own way to get these things done. So that's a lot of the stuff that we are doing just now. So it's so hard to define what Time for Change is, because it's so many different things, but I hope that helps.
No, definitely. I mean, it's so many areas that work, and some of them it is just simple things, like you said, being able to, someone having a phone, so they're able to sort out their housing situation themselves. If they haven't got a phone, they can't do that. And that story you told about the pregnant lady who, was sort of begging on the street just so she could have some heating for when her kids visited is just, absolutely heartbreaking. And I think I'm sure that everyone watching thinks it's amazing that, after everything you went through, you now want to help other people. I mean, that's, through the work you do for us and by studying social services. And, so I think, we're really lucky to have you on board with us with, having had that experience in your past. I think you can really relate to these people and know what it is they need. And I think a lot of that is probably to just be treated like a human, because it sounds like, when you're in temporary accommodation, or for those that are on the streets, it's you don't feel like that. I'm just wondering if you can tell us a little bit about, who are the people you help? Have you got any examples of people that you've spoken to? I know you mentioned that lady you spoke to last week.
Yeah. I mean, there's a huge number. So I mean, the other guys, so Michael and Lindsay, they've already helped so many people. They're the other peer mentors in Edinburgh. Before the restrictions got tightened again, me, William Wright and Greg, who's again just came on during COVID as part of Time for Change, although he was previously within the hub support. We walked about within a space of 200 metres. We met 3 different people, and their stories were so different. But strangely, the last lady that we spoke to, again, this was another pregnant lady. These are on the streets. Another pregnant lady was someone that Greg had already been dealing with. He couldn't obviously identify himself as who he was, just for sort of safeguarding. But the people that we try and help are basically everyone. What we find a lot is a lot of the people that are on the street begging. Some of them are homeless, some of them aren't, some of them are sofa surfing. A lot of people, you don't get pushback from them, but there's a lot of people on the street that when you speak to them, they seem quite happy. Not happy. Happy is the wrong word, because they're not happy, but they seem willing to accept the situation that they're in, because they've got that. This relates purely to traumas, past or present. They seem to think that this is okay, or this is acceptable, not for them themselves, but the way they've been treated. So yeah, I mean, just to use Friday as an example, there I spoke to one guy who was street begging. He'd been sanctioned by Universal Credit, so he was given £13 a month to live on. And he was street begging. He openly admitted that he had issues with alcohol, and he was street begging so that he could get money for alcohol, because he didn't want to take away from his mum's benefit. He didn't want to take the money off his mum. He wanted to be able to do it for himself. He didn't want to go down the route of getting accommodation for himself, because he was quite happy staying with his mum, even though he wasn't allowed to be registered there. And these things, these people are invisible. No one thinks of them as being homeless because they've got somewhere to stay. That's not what homelessness is. Homelessness is not having safe, secure accommodation. He didn't have that, but he didn't see himself as being homeless. There was another guy who literally just got out of Barlinnie, the prison in Glasgow, and he was sitting. He was really funny. He was sitting with a bike wheel on Leith Walk, with a bit of steel wool, and he was just de-rusting it. So he was just de-rusting the spokes because he wanted to start his own bike business, but had no idea how to do it. So I tried to get him in touch with Scottish Enterprise and with the DWP, the Department for Work and Pensions, to see if there was some sort of grant or something he could get to maybe start up his own business. He had issues with Valium, I think it was, that he quite liked taking, but he just seemed so. He didn't drink, he didn't smoke, he liked Valium. But he was only street begging because when he got released, he didn't have any access to services because he didn't have an address. Didn't have access to services, so we tried to fix that, and then as it turns out, he was staying with his girlfriend, but he couldn't register as staying with his girlfriend because that would then affect her benefit. And this is a massive issue. It comes down to poverty. The benefit system is it's actually taking homes away from people or preventing them from getting housed, and it's creating this huge invisible society, where you might see people begging on the street. When I was homeless myself, I never had to do street begging because I was working 2 jobs. But if I wasn't working that day, I would just walk. I didn't want to stay in the tent, so I would walk, and I would literally walk the length and breadth of Edinburgh, and no one would have known that I was homeless, but I was. No one could have stopped me and tried to give me assistance because they wouldn't have known any different from anyone else walking down the street. But you really feel invisible. The mental traumas that this causes is huge. And that's a massive part of what we're trying to do with Time for Change, is we're trying to identify and find more people that we can help. One of the things that we want to do and hope to do is we want to be able to get inside these temporary accommodations to speak to people, because in a lot of cases there are people that are in there who could be housed quicker if we can identify the issues that they need addressing. Like Ellen and Heidi were saying, so people with complex needs or maybe mental health issues, if we can get these diagnosed, like you say, it's a catch-22, if we can get these diagnosed, that will help them get the housing that is right for them, because there's no point in giving a flat or a house to someone if they're not able to maintain it. You can't do that. That just it defeats the purpose of homelessness. Isn't just a one-stop shop. It's not just about saying, okay, we'll give you a house. That doesn't address the underlying issues that maybe caused the loss of the previous house. But yeah, I mean, the people that we're trying to help, like I say, the biggest thing that we do just now, it's something that I hope that we can continue to do, and I want to increase it and ramp it up. And again, guys, we can only do this with your support. So massive thank you to you for doing this. But is presenting at council offices, I think, is going to be a massive win for us. There's another huge thing that we've just done as well, which is actually changing policy for Public Health Scotland. We had a massive, I think it was a Teams chat, so not Zoom, but it was a Teams chat with the bosses, Alison King at Public Health Scotland. And it was huge because on the back of that chat that we had talking about temporary accommodation, and the stats are pretty scary, guys, because just as an example, for 2019, 45 homeless deaths in Glasgow, 43 of them, 95% of them had temporary accommodation. So only 2 of them were rough sleepers. But when you see it on the news, you always see a picture of someone rough sleeping. But on the back of the Public Health Scotland's call that we done, which was hugely beneficial for everyone involved, they're actually changing their framework. So they're creating a new framework on how to deal with people in temporary accommodation and how to approach that. So that'll be a really interesting report to get out when it gets released.
Yeah, no, that's and like you say, like people in temporary accommodation are hidden homeless. Like you say, you were walking down the street, nobody would think that you were homeless, or but the amount of people that are living that way and therefore not able to really work properly or study properly or get the help they need for mental health problems or physical health problems is absolutely huge. So I think it's been really important for people to hear from you about how awful it can be to be in temporary accommodation. And it sounds like the work you're doing with Public Health Scotland is absolutely amazing, and hopefully they'll listen and we can start to make some improvements. But thank you so much, Andrew, for coming along today and chatting to everybody. I think it's been really important for them to hear your story and about the amazing work that Time for Change do. And I think there's actually been sort of from our transforming rehabilitation service and from the stuff you've been talking about, there's been a lot of stuff that sort of overlaps, such as not being able to get access to any services that you might need for your health because you don't have a home. But then also, on the other side of it, I think some people think, well, people in temporary accommodation, they've got somewhere to sleep at night, they're fine, but it's not, is it? It's not fine at all. And that's something that we continue to work on. The work that you guys are doing is absolutely incredible. So thank you, Andrew. Thank you for joining us today. And now, if anybody has any questions for Heidi and Ellen or Andrew, now is the time to ask. So you can either ask in the chat box, or you can feel free to put your cameras on and your microphones on and ask the question out loud. Roz, have you had any questions coming through from people?
I've had a couple come through privately, but it was great to hear from all the speakers. I think everyone's just doing such amazing work.
Yeah.
And, a really big thank you again for everyone that's supporting us and for their hard work. I did have a question through for Ellen and Heidi around, is there any really standout clients that you've worked with in the past that you've that sort of are really memorable and that you're sort of most proud of their sort of journey with you?
Yeah, I can take this one. There's been quite a few, really. I think one of the hardest things for us is that we don't look at outcomes once that person leaves custody. So you don't necessarily always know all the hard work that you've put in, if it's been successful or not. The only true way of finding out is if they ever come back into custody, which is a shame. And there's been a couple, I used to be a frontline worker before I came into this role I'm doing now. And the ones that you never see again, you think they've done it. This is the time they've done it. And there's a period of time where they get to a point in their life where they say, all right, I'll not see you again. I'm going to do it this time. You think, come on. And it does happen, and it's a fantastic. And I used to run it's one for me, it's quite a low level sort of intervention, but it was how significant a simple conversation can be. And I used to run group workshops around employment and also good tenancies. And this person said, "Oh, I really like dogs. I want to work with dogs." I was like, "Okay, what's stopping you?" And he was like, I don't know. And I was like, "Okay, you've got a goal. Let's look at that goal." And we worked through, obviously, what he needed. He needed accommodation. He needed to be independent. He wanted that employability. So we worked on an action plan, and we went through all the necessary steps, got in that wraparound support, got him appropriate and secure accommodation. And he achieved that outcome in the end, simply from just saying in a workshop, "Oh, I want to work with dogs." And it's about us working with them people, really listening to what they want, and sort of supporting them to achieve that. And for me, although it wasn't a huge outcome in terms of, you know, the risk levels, it's nice that they don't come back into custody and they have achieved their sort of goals, really. That's sort of mine.
Yeah, that sounds amazing. Yeah, like you say, it can sometimes just be the sort of little things and the little goals that they have that can really sort of inspire them to move forward with their lives and not end up, you know, back in prison or back, you know, being homeless, and to really move forward with their lives. So that's fantastic. And Ros, you said we have another question.
Yeah, I've got a question for Andrew as well that came through. I think you touched on this a bit, Andrew, but it was just around, like, in your opinion, like, how does homelessness and living in temporary accommodation, like, affect people's mental health and, like, personal sort of development and just generally, like, their well-being?
Yeah, so I think it's probably fair to say it's different for everyone. But when you're going through the process in the way that I did, you don't recognise it as affecting your mental health. It's not until months, years later. In my case, it was years before I understood. Sorry, I'm smoking a cigarette there. Yeah, it's not until years later that you realise just what an impact it had. I got diagnosed with anxiety, depression, years later, and I suppose it's a form of PTSD. For a lot of people who've spent a lot of time on the street, or in temp accommodation, and again, I will go back to temp accommodation, so sorry for rattling on about that, but the vast majority of people who are homeless or classed as homeless live in temp accommodation. They have a roof, but a roof is not a home. It's not enough, and it slowly grinds away at who you are, at your confidence. It's so many different aspects of your personality. You become a different person. And people that you might have known, even family members, won't recognise what you've gone through. And there's a massive sense of, and it's a big one that I want to hit on, there's a big sense of shame that goes along with that, because you feel like you've failed somehow. And it's not you that's failed, it's the system that's failed. The system shouldn't allow these things to happen. But it's a huge issue. If you go in to, if you become homeless or you go into temp accommodation and you've already got mental health issues, those are exacerbated by a massive amount. But if you go in, and I went in, like I say, I was a union rep, I went in happy and pretty well adjusted, and it wasn't until about 4 years, so I mean technically I was homeless for 6 years, but it wasn't until I came out the back of that I realised just what an impact it had. And again, like I think Ellie and Heid touched on this when they were talking about the projects they do, and the work they do just now with the wraparound support, that is absolutely fantastic. Like, hats off to you guys. The underlying traumas that this causes aren't recognised initially. They're not recognised immediately, but it's something that's there and it needs to be looked at, it needs to be addressed. And I really hope that we can move forward with something, keep pushing public health bodies and the government to get things changed, because it's not good enough. It really is. It's really detrimental to people's mental health.
Absolutely, Andrew. I think you've put that perfectly, and yeah, I think you've opened a lot of people's eyes to to the impact that temporary accommodation can have on people's mental health. And like I say, particularly if you go into temporary accommodation already having mental health issues, just absolutely horrific. So yeah, thank you for sharing that with everybody. And now just to open up some questions to the floor. I don't know if anyone has any questions. If not, then not to worry. But does anybody watching have any questions they'd like to ask? Just hold for that awkward silence for a minute. No, that's absolutely fine. No worries at all. I mean, well, what amazing things we've heard about this morning. It's been such a difficult year, I'm sure, for everyone watching today. We've all had to make changes in our lives, and it's really hit home how difficult it is. But if there's one thing that we've learned, it's that together we can all make a really big difference. And actually, one way that we are doing that, and some other people are doing that, is by taking part in our flagship winter walk event. And I know Andrew did actually mention that a little bit earlier. So that's called the Big Walk. And on the 10th of December, me and many of my colleagues across Shelter, we're going to be walking 10K wherever we may be. We're all in different locations across England and Scotland. And we're doing that to unite against the housing emergency in a way that's sort of together but apart at the same time. And we're encouraging as many people as possible to join us and do the same, or even a shorter distance, it doesn't matter, any time between the 7th and 13th of December. The event is absolutely free to enter, and there will be some fantastic merchandise available, so some woolly hats. And I am very excited about this. Well, my four-legged friend Pablo is extra excited about this. We're getting dog bandanas, and I think they say big walkies on them, which I can't deal with. It's too cute. I can't. Oh, I'm going to have to get one of those. But to find out more about that, not necessarily dog bandanas, I think that's probably just me that gets excited about that. You can search Shelter Big Walk on any search engine, and it'll take you to their website where you can find out more, access downloadable materials, and find out how to join us. So why don't you join us and get your friends and family involved, get something positive out of this year, and know that we are helping to fund the amazing services that we've heard about from Heidi, Ellen and Andrew. So a huge thank you to them and to Polly for taking time out to tell us about the incredible work they're doing and speaking to us today. And of course, thank you so much to you for joining us today and for your support during this strange year and beyond. Who knows what's going to happen, but we know that we have amazing support from all of you guys who are here today. So thank you so much. I hope you've enjoyed this morning and learned a lot. I've certainly learned a lot. And I hope you all have a fantastic weekend.